I'll be joining in a minute. Thank you.
Yes, good morning, everyone.
Good morning, Francis.
Yes, I apologize for the background noise that is happening on my side. I think we wanted to start, however, we're waiting for one of the presenters to join us such that we can start. Let me just try to follow up with him in like the next 2-3 minutes. I think we should be starting.
Francis, are you referring to me or somebody else?
Hey, okay. Dr. Innocent, you are welcome.
Thank you, Francis.
Yes.
Sorry for being late.
I think we can start. According to the program, we are supposed to start with the welcome remarks from the Water Resources Institute. This was supposed to be made by Dr. Calist, the Acting Director, Water Resources Management, the Ministry of Water and Environment. However, he's attending another meeting, so he requested that I stand in for him. I want to welcome you all to this 26th webinar, monthly webinar for the Water Resources Institute, where we call on a number of experts to come and present and also share their experiences. They share their work, what they are doing within the sector. So for this webinar, we are borrowing the successes from the recently concluded Water and Environment Week, whereby a number of presenters we had more than 80 presenters. Like Stacy will be giving adding more on this. Many presenters presented. However, we selected the best 3 presenters, and these are going to be presenting their findings for today's webinar. I want to call upon Stacy to come in. She will be introducing the presenters, and also she'll be moderating the session. The webinar is for 2 hours. We'll start with the presentation, then later we'll have the questions and answers. Thank you so much. I hand over to Stacy.
Okay. Good morning, everyone. Thank you so much, Francis. I hope we have both all the presenters. Do we have Blaunie? Are you on the call, Blaunie?
Yes, I am.
We have Evans.
Yes, I am.
Do we have Dr. Innocent?
Yes, I am in.
Okay. We are grateful to have you. And this is like Francis did the introduction. Privileged to have these 3. These are actually a selection of the people that presented to us during the Water Week, last 2 weeks. These were the best, and I'm glad we have them talking to us today about the innovations. And in the interest of time, I'll usher in Dr. Innocent to start. After Dr. Innocent, we shall have Brownie or Evans, whoever would be available by that time. Then we shall take in questions. In the interest of time, we shall give minimum 25 minutes to each person to present. So Innocent, you're most welcome once again. We are glad to have the Jengu units talking to us today morning.
Good morning, everyone, and thank you for giving us an opportunity to share our study findings, as well as talk to you about our innovation we're trying to pilot in Changwari refugee settlement, see how it does perform. This, I must say, is a collaborative project that has lots of partners, like we shall be seeing in the later slides. So I'm Innocent Tumwebaze Kamara, an associate research scientist at the African Population and Health Research Center based in Nairobi. Just a bit of a context, APHRC is a premier research to policy institution that generates evidence as well as strengthening research and related capacities and development ecosystem, alongside engaging policy to inform actions on health and development. So our work largely centers on research and related capacity strengthening, research, as well as policy engagement and communication. And we have projects across different countries in Sub-Saharan Africa. So back to the Jengu project. So we basically share some reflections from the testing of this Jengu unit in a crisis-affected population. And in this case, we shall be focusing on Changwari refugee settlement in Uganda. So just the context of the Jengu unit. So the Jengu unit is made up of different kinds of parts altogether. I think that is also one thing, as requested, talk about in this presentation. It has got different features altogether that constitute the Jengu unit. And I'm glad some of our colleagues are actually on this call, so they may also have time to share with you when we are responding to your questions. So idea, it's made up of, it has got a basin, like you're seeing. It has got a compact and stackable part. It has got a pump. It has got those stability kind of slates. It has a drainage pipe. It has got a robust and stable, as well as usable kind of stands. It has a compartment for the liquid soap, but you can also use our normal bar soaps. It has got a faucet. It has got a water flow. And then it has got a mirror, which again, this is another most likable feature for this kind of complete facility. So we have a drainage pipe or hose that takes away water from the basin, but we also have a pipe that then gets water from the jerrycan, just like you can see in this picture from a homestead in Changwari. And then also the unit can be made for different kind of groups of persons. The children, like in the ages of 2 to 6 years, as well as those in mid-age children, so call it 7 to like 14 years. And then also it can be tailored to people with disabilities. So meaning that instead of the conventional foot pump, you can also have a pump where they can use the elbow, especially like for people without legs or different disabilities that are not able to step on the foot pump. And then in this case, you can also have the water container, which can be a jerry can or any other container that gets water from the jerry can through the tap to the basin, also like on the right hand kind of side. And then also, you can also have a version for adults. So in terms of the sizes, all these can be varied based on the target user groups. So why crisis-affected populations and with this JENGO kind of facility? One thing we know that is that crisis-affected populations always face heightened risk in terms of diseases, mainly stemming from limited access to water, sanitation, and hygiene facilities, as well as other basic health facilities. And we know that from literature, from more studies, that access to hand washing facilities, of course, that are desirable, together with soap, have potential to increase hand washing with soap practices, which are one of the main effective preventive measures to prevention of most of diarrheal diseases, but also other respiratory kind of infections that originate from poor hygiene. And we know that during COVID, actually there's a heightened promotion of hand washing with soap compared to all the decades we have had these promotions. So in terms of the JENGO hand washing facility, this is a facility that is largely developed by our partners in the UK or collaborators on this project. And it has been running on for over 3 years almost, and piloted in different countries like you're seeing here in different contexts. But in terms of moving to refugee settings or humanitarian settings, this is the study that we are largely focusing on. And this is the first time it's being piloted in such settings. So what we show here are basically different areas the JENGO unit has been used. The picture you see on your left down is actually the Red Cross offices in Changwari. So the initial engagements and pre-community visit, the visibility of this study, and also whether we are able to find like local manufacturers. There are some units that were tested at the health facilities, which still exist. So this is the basis, and this is a step beyond having this unit in homes or health facilities to see how then it works in humanitarian settings like refugee communities. So in terms of the initial like pre-study activities that had to be done was trying to see whether there are possibilities of finding local manufacturers within our context. And by context, I'm here looking at Kenya and Nairobi, since the whole development of this unit was largely in the UK. And then second is to see what kind of course, designs and materials are in place or can be shared. Then getting quotations in terms of getting to know what it would cost, for example, by the local manufacturers to produce JENGO units locally. but also looking at the buyer places order with the manufacturers, as well as the kind of materials that are existing in the local market, as well as having these local manufacturers then do produce some samples and to look at the quality of these samples before they can collaborate in production of local units. So in terms of the production, the units we tested in Changwari were largely were manufactured from here in Nairobi, but we also know that there are some manufacturers in Uganda, such as Kali manufacturers, though what differed mainly was the cost of production of these units. So we know that lots of innovations exist, especially in terms of the hand washing units after COVID or during the COVID period. So lots of innovations came into place. But what is mainly limiting is that while these innovations do come into play, most of them have limited human-centered approaches, whereby these innovations being tested in different contexts to understand if they do work in these different contexts and what we always need to bear in mind. So because of limited co-design and testing of most of the existing innovations, so we thought having these units also tested and co-designed with the communities in the humanitarian settings would make a difference, but also for us to learn in terms of seeing how effective they are in promoting hand washing with soap behavior, which was our main focus, but also the other learning aspects regarding their durability, their acceptability in this kind of context. So FHRC, together with its other partners, undertook the 3 years kind of study, which ideally was also hindered or in terms of the progress disrupted or delayed by COVID. But throughout the period then, for us, it was to really understand the different kind of or facets or dynamics in this facility regarding its suitability in humanitarian context, as well as aspects of acceptability, desirability. So in our research questions in this study were then to understand if Jengo is acceptable and effective and how it's perceived in relation to other existing facilities. Other existing facilities, you are looking at the use of basins, some use pans, some use cups, some use tippet taps. So all these kind of existing facilities, see how then they compare with the Jengo facility. The other such question was to establish if the Jengo resulted into increased rates of hand washing with soap, and if these rates are maintained over time. The other was to establish what was required to set up and scale up sustained local production of Jengo hand washing units in the local markets. And lastly, the durability of Jengo hand washing facility and what was needed to maintain the facility. Yeah, so Changwari Refugee Settlement is a home to over 130,000 refugees and asylum seekers. And this study was largely looking at 4 of the communities, 4 of the villages in this community. And our selection was largely based on accessibility to water, as well as having a mix of the old and new refugees in these areas. We did conduct surveys, structured surveys, both in terms of the household surveys, but also looking at structured observations on the performance of hand washing practices. Here we coined it seeking to understand the daily routines of members in this homestead. We are observing all members in the household, though the survey was largely focused on the household head or next in charge in that household. We did perform key format interviews. We did conduct in-depth maintenance interviews and spot checks on the facilities together with those who are using the facilities. And then we also did focus group discussions. And how it was structured, we had 300 households that were randomly selected in these communities from the survey. And after that, we did randomize the households to those that were provided the Jengu unit and SOP, as well as the households which were being provided SOP. And SOP was largely being provided on like a bi-monthly basis for the study period. So in Changwali, we had a shortened intervention period because of, again, different kind of contextual situations. We had 5 months of the intervention. So during that, we had 3 rounds of soap supply, which also includes the host communities. At the end, when we are seeking to work in this community, the current refugee policy is that there has to be something for the host communities, like a 10%. So we had also some soap, one point in time soap being provided through the Prime Minister's office to the host communities. And in Changal, we're largely working with Red Cross as our partners. Just in terms of simple findings, just from the basic descriptives, Kangwali largely uses boreholes as their main source of water, together with piped water sources. In terms of the public tap stands, though these are largely not equally distributed. There are some parts of the community that are more water stressed. But for this study, we needed areas that also have access to water, because for you to perform the hand washing practice with ease, you need access to water. Most of them spent over 30 minutes around water collection, the process of going to the water sources and coming back. And this picture shows you that sometimes there are peaks because of more community users to limited sources that are in these communities. In terms of sanitation access, most of them were dependent on pit latrines with slabs. Here we are looking at a pit latrine with a slab is a pit latrine that is largely cemented or has these plastic slabs, while that without, basically our conventional pit latrines where you might use a log and just cover it with some sand or marshes as a slab. And then, of course, and also those who were using open pits and those who didn't have facilities. And in terms of hygiene practices, mobile vessels were the most used for hand washing needs. In the context of our Jengu hand washing unit's ability to increase hand washing with soap practices, what we show here is if you look at the baseline results that are indicated in the green for both the intervention and the control arms, we see that at the end of the study, we saw a 3 and fourfold increase in hand washing with soap moments. So we are measuring moments. How we did it in each of the communities, like I said, we are doing structured observations. So we had our enumerators stationed in these homes for 1.5 hours to 2.5 hours to just understand what is taking place in this home. And we're looking at all kinds of members of the home, from children to the adults that were within the home during the observation time and the study period. And we had these observations at the start of the study through and at the end line. So we would conduct both a household survey and an observation. While for the spot checks, we also had different intervals to check on the facilities, see how they're being used, and also have some maintenance interviews with selected households, see how they're interacting with the JENGO units. In terms of acceptability, there's largely a great acceptability of the facility, and most people liked the mirror. But also what we say was that soap itself, availability of soap itself, has an effect on increased hand washing with soap practices. And this one, you see it in the end-line control arm, because for the control communities, the control households were also providing them soap in this study. Just in terms of functionality of the JENGO units, again, which formed the basis of our learning in this study, was around the type of plastic basins that were used. While largely all the different other features were largely intact, the greatest challenge was on the type of basins. These were largely recycled basins, but they proved not to be resilient in this context. So from the spot checks, I must say what is reflected as 9 months was actually after 5 months of the intervention. From the spot checks, then would get to say if the different features of the JENGO units were still functioning. So we used to have a 2-monthly checks on these units. We had a longer observation period in Kenya than we did in Uganda for Changwali. So, but here you can see that overall, while the units were working, so most of the basins were breaking. So in terms of what improved, in terms of going forward, to us, this was our greatest learning point, that we need to be mindful of the quality of basins that are used. And there are lots of basins in the local market. So like tailoring the basins to the context really becomes important. Yeah, just to wind it up, what we largely found was that availability of fixed and desirable hand washing facilities, like the JENGO in this case, has potential to increase hand washing with soap behavior. And the community showed great preference of the JENGO hand washing units. And like I mentioned, with the resilience of the type of basins that were used, that became a limitation to the performance and use of the facility. And also what we noted, or what we observed, was that soap, and it being insufficiency, is important to both sustainable hand washing with soap behaviors, especially in the long run. So these are some of the main observations from this study, and we do provide some reference to different materials on the JENGO hand washing unit. Of course, a great appreciation to our partners and funders. Like I said, this was a collaborative study that engages and involves different partners. And the study is largely funded by Research for Health in Humanitarian Crisis by WRI, which is largely enhancing learning and research in humanitarian areas. So we had different partners, the British Red Cross. We had Arup, which is the main designer for the Jengu unit. We have us, EPHRC, then the Ugandan Red Cross for the case of Uganda. Then we had Kenyan Red Cross here. And then in terms of research, we're also working with the London School of Hygiene and Tropical Medicine. And from the Red Cross umbrella, we also have the International Federation of Red Cross. Thank you for listening. We are now open to your questions.
Thank you so much, Innocent, for this wonderful presentation. We have many questions in the chat, but maybe we can first take up the hands. People who would want to ask Innocent directly, but I saw questions like how much is the unit. I also would ask in the same question, how much is the unit? This is interesting. I'm very sure most ladies on this call, you'd be interested since this Jengu unit has a mirror. So Innocent, in the questions you're going to ask, maybe you have a lot of inclusiveness. We saw all the ages were incorporated. The young ones can benefit, middle age and adults. So, and this is gender inclusive by a mere fact that we have the mirrors involved as one of the parts. So I'm going to take in on questions. The how much question, Innocent noted, but let's see if anyone has a question for Innocent. Kindly please put up your hand. So in the meantime, Innocent, as people think of the questions, number one question I'd seen was how much is the cost? How much does this facility cost if one is adopted for use at household level? Secondly, what are the major operations and maintenance considerations for the facility? Any lessons on private sector involvement, since they can be a good vehicle to take this forward beyond the project lifespan? Okay, Innocent, maybe you can first take in those two questions as we look for more questions.
Thank you, Stancy. Maybe before I take in the questions, let me request my colleague Sheila to also just say something, and maybe she'll also be responding to some of the questions if need be. But Sheila, you're free to add your voice to this.
Yeah, thanks, Innocent. And I am just checking on the price. I will get back to that response just now. I'm just checking something on the price. But yeah, thanks.
Okay, so thank you, Sheila. So in terms of the prices, like I said, these units were produced locally. So all the innovations started in the UK, but the current focus is trying to decentralize, to localize these units. So for the ones that were used in Uganda, they are manufactured here in Kenya, apart from the pump. So we had not yet found a locally suitable pump alternative. So the pump was largely gotten from the UK, but this is again part of the follow-ups that are going to be happening in our subsequent engagements with the manufacturers here and also the designers in the UK who will also be in Kenya sometime in June, and we can also reach out to Uganda. So initially we had identified 2 local manufacturers. In Kenya, we had Pipeman, and in Uganda, we had Kali. Uganda, and then they did provide the quotations. So in terms of the quotations, so we had the Kenyan manufacturers at that time, it was 85 pounds per unit. And then for Uganda, it was 151 pounds per unit. So, and of course, here you're looking at limited production, limited local production. And that's the reason for the high cost. But in terms of going forward, when everything is set, this cost will definitely have to be coming down. So you're currently looking at about $100. But these are costs that are still likely to get down based on the demand and production in the long term. So in terms of public-private partnership engagements, yes, it's largely driven on this. And this is why currently the local manufacturers are being involved in it. And really still studying the market base to identify more kind of potential manufacturers. So this is also work that is still going on, so that in the long run, everything is decentralized or localized, and potential users can always reach out to these manufacturers for these units whenever needed. In terms of maintenance and operations, again, most of these materials that are used on this unit are materials that are locally accessible in the markets. So in case, like say, a pipe that takes water from the jerry can to the sink gets eroded or destroyed, it's easier to find a replacement for it. Likewise, the drainage pipe that would take the wastewater to either soak pit or collecting it and pre-treated for a plant. These materials are basically locally always accessible. So like we said, one of the challenges and concerns, I think, were on the pump, for which, again, we didn't find problems through the study period, but this is one of the options that still has to be greatly thought in terms of localization, so that in case something happens to a pump, it can also be easily accessible. The other aspects, of course, with any kind of facility, hygiene or maintaining sensitizations becomes important. For this study, we did pay a blind eye to sensitizations because our focus was just see if a facility itself, a physical structure itself, this facility can improve hand washing with soap. But then what happens if you complemented this hand washing facility with hygiene promotion or sensitizations, then would expect a greater kind of effect. So in terms of combining both, this is one thing would want to also study and see how much added difference it does. But maintenance is always important, because just cleaning the facilities also remains crucial. So basic kind of cleaning of the facilities is equally important. I think that's what I can say on that.
Okay, thank you so much, Innocent, for the elaboration. The cost, I hope we have all heard from Innocent, but Innocent, still the cost of 151 pounds in Uganda. It's still a bit high. We believe it's going to reduce, like we promised. It's going to reduce gradually. There was another question, and I hope if there's anyone who has a question directed to Innocent, should bring it up. Let me check in the chat. Operation and maintenance. Then Sheila says, indeed, the private sector can be a good vehicle, especially in the local production. I think we have no more questions for Innocent. Okay. Sheila was saying some of the challenges we encountered were transportation of the units from Kenya to Uganda and the high demand for units from the recipients beyond which we could handle. Wow. I'm glad most Ugandans loved the units, but the cost, Innocent, we believe it is going to come down for a local Ugandan like myself to have it at my own household. Thank you.
Like I said, maybe just to add, from the manufacturers we used, these were limited kind of units. And then that's the reason for the costs. But in terms of mass productions, if there are mass productions, definitely the price would be different. And also looking at the target communities we are looking at. Thank you.
Okay, thank you so much, Innocent. I think if we don't have any other question for Innocent, we shall go to the next presenter, who should be Brownie. Brownie, are you on the call? Ebal, Brownie?
Yes, I'm present.
Okay.
Yes.
Brownie, you're most welcome.
Hello?
You're most welcome. Innocent, maybe if you can stop sharing.
Yes.
So that's Brownie. Yes.
Hello? Can you hear me?
We can hear you, Brownie. The floor is yours.
Yes. I thought
Brownie, your network is not stable.
Hello?
Your network is a bit shaking. Do you mind having a stable network location? And the rest of us members on the call, we can have our questions in the chat. In the meantime, if anything comes up, we can put it in the chat. We shall have a feedback in the chat as Brownie starts her presentation.
Maybe. Hello? Hello?
We can hear you now, Brownie.
Is it better?
Yes, we can hear you now.
Okay. Let me go down to share the screen.
Brownie, is there any challenge? Kindly share
Hello?
your presentation. Brownie, we are waiting for you to share your presentation and you have 25 minutes.
Yes,
We believe by 1 we should be ending and we have another presenter after you.
I'm trying to share the screen. Okay. Are you able to share the screen?
We can see the screen now, but kindly put in presentation mode. Members, I think Brownie has a technical challenge. I'm going to call on Evans. Evans, if you're ready, kindly share your presentation as Brownie sorts out her network. Modi, Evans.
Yes.
Kindly share your work. I think Brownie has a network challenge right now. Kindly share your presentation, then after your presentation, we can go back to Brownie.
Okay.
Can you see it now? Or
Evans, sorry, Brownie has come back.
Okay.
Brownie has come
is
back.
it okay now?
Let's listen. It's okay now.
Okay. I apologize. Good morning, everybody. My name is Brownie Abel. I hope you can see my
Brownie,
video.
kindly be louder than that.
My name is
Yes.
Brownie Abel. Yes.
Kindly be louder than that. Okay.
Is this louder? Is this louder? Can you hear me now?
Yes.
Hello?
We can hear you. Maybe get
Okay.
closer to the microphone.
The presentation is about the role of legal innovations in reducing non-revenue water and enhancing environmental literacy in Uganda. I work in the legal directorate of National Water and Sewage Corporation. The biggest challenge that we have as national water and utilities across the world is in regards to non-revenue water. The total annual cost of non-revenue water is $14 billion, and this presents about 50 to 60% of water supplied, with a global average at 35%. This means that if we just invest even this half of this money, then we can be able to supply water to additional 100 million people. So because of non-revenue water, there's a lot of water. There's a lot of water that is being left unused, and it can be used to actually help others and improve on the water capacity in the country. Uganda uses billions of cubic meters to treated water annually due to theft, meter tampering, and illegal reconnection. And this leads to significant for us to enhance the livelihoods of Ugandans. We have to see how to reduce this illegal water use and reduce the non-revenue water. So the goal of the paper was to focus on fighting non-revenue water through the legal avenue, and also enhancing environmental literacy to secure access to water for improving livelihood. The innovative products that have been done in the legal fraternity are two. That is the utility court and the legal aid clinic. The data was collected from the utility court, which was established by the judiciary in 2017, and the legal aid clinic that was started in 2019. The utility court was started for us to enable specialization in regards to utilities. These include national water, UMBS, WRSB. Through the Chief Justice, they created a specialized court to enable the judges understand particularly the issues that affect utilities and to dispense with justice faster than how it was because it was taking too long. The Legal Aid Clinic was started in 2019 by the Legal Directorate, which was in twofold to educate the staff on the legal regime that govern their operations and also seek to resolve customer disputes to alternative dispute resolution and ensure that people can be able to resolve their issues instead of having backlash in terms of cases, and maybe instead of paying national water for let's say 100,000, 200,000, instead of going through that lengthy process, we decided as the directorate to come to the people, understand the customer's issues and resolve their cooperation, and also reduce on the money that is being spent in court and adjudication. The data was gathered from the utility court. The utility court sits at Makinde. It has a chief magistrate, Gladys Kamasani, and the National Legal Department. This was through one-on-one interviews and focused discussions that was talking to the chief magistrate, the magistrate in that area, and also the legal department. So since the establishment of the utility court in 2017, we have had cases that used to take 3 to 5 years are now taking only 6 months to 1 year, depending on the complexity. Yesterday, we actually had a verdict in regards to water theft and tampering with our pipes and infrastructure, and the person was given 8 months imprisonment. Also, in this regard, the case which ordinarily in the judiciary system would have taken 3 years, this verdict was made in a space of 6 months. So because of one, the specialization of the team, that is from the magistrate to the prosecutors to the people handling the matters, it is quicker for each to be resolved. And instead of, let's say, having many adjournments, for example, the cases are heard maybe the next day if the witnesses are available. So cases where it will take 2 weeks or 3 weeks or a month for you to get another court date, the court date takes, it can be the next day because the magistrates are available and there is specialization in that regard. So on the first picture, we have one of the suspects, and then we also have the police. This is a collaborative effort. We work with a security team, that is our investigative officer. These are also trained specialists for, in this case, national water, for water-related cases. So she is explaining in regards to the exhibit that is being tendered in the picture of the illegal connection and what he was doing. So these police are called environmental police. They're under the environmental police, and they work. They are given technical expertise and technical training in that particular area, so that they can be able to prove beyond reasonable doubt that this happened, and also handling the exhibit. On the far right corner is one of the culprits who was arrested and convicted. He was convicted for meter theft, and him is serving 2 years imprisonment. The legal aid clinics, since inception, legal aid clinics, as we said, was national water legal staff going on ground and talking to the branch staff, that is the food holders, and also the customers. So the legal aid clinics since 2019 has so far impacted 500 customers and collected over 1 billion shillings from those customers, bringing back them on supply. So reducing on the amount of water that is being stolen, and also because when you're not on supply, it is easy for you to connect or find alternative ways to get water that is not through the right channel. So through this legal aid clinic, we look at the accounts that people have been suppressed in the system. That is, they are no longer working, sorry, they are no longer effective, they are effectively disconnected, and we go to the branch. When we discuss with the branch team, we discuss with the branch staff about the legal regime. So this is in regards to the literacy, the legal regime that is governing what they do, and to show them that their rights are up to this point, and also to understand what customers' rights are. And then when they are doing their branch work, it will reduce on the legal risks that they are doing. So the illegalities that them as staff maybe may not know, but it also empowers them to know, I have a right to be here. For example, you tell them you have a right to, as per the law, you have a right to enter and meet the meter. So they can be able to meet the meter. And therefore, I need the ability to actually enter into the house, because that's what the law covers. But maybe also to tell them that the law covers you only reading the meter, but it does not cover you going and doing things outside what you're supposed to be doing. So this prevents also us from being sued for taking illegal actions, or from our staff doing things that are not allowed by the law. And this has helped with reduction of the flimsy cases that come, but it has also helped in ensuring that non-revenue water, because the staff also can be able to identify, for example, which kind of connection this is it illegal, is it not, is it bypass, so they're able to know and identify, and when they know this in time, they can be able to effect the penalties that are needed, and therefore prevent loss of water. On the left, we have here talking to like customers, and then talking to the branch team, that was the Pakistan branch. And then on the right, we are also here engaging a customer, that was a Sudanese customer that had been on Palmisa, where they had overestimated her, and she was able to resolve that and put back on supply. We also educate the staff in regards to estimation, that they don't have just the right to just estimate without any basis. They have to estimate with a basis. So this has got one, less legal issues that are being taken up, but also the trust in the customers. And through these clinics, we also educate the customers of the convictions that we have had, because we have had issues where the customers, when we work with the people, the customers believe that maybe the people who are stealing their meters, or those who are national water staff who are stealing and reselling. But when we show them that no, these are people in the community, there are common things that are doing this, when they see the convictions, when we tell them about to report such instances, when they see that their action has yielded a result, then more of them are inclined to participate and get involved in fighting illegal water use. These interventions have led to a reduction in non-revenue water from the average of 42% to 5%. So we understand that fighting non-revenue, it is something that is done collectively. It is something that if we do not work together, we cannot be able to stop it. This is also shown in our engagements with the utility court. For example, there was a case where the convicted was arrested by the LC1 chairman. So the LC1 chairman saw him and suspected him for stealing because he looked suspicious. And when he saw that, he arrested him. He did the citizen arrest, and then called the police, and our police came. When our police came, they were able to search him, and when they searched him, they found found he had stolen 2 liters from the stakeholders, from all these people. When that happened, we were able to have him convicted in about a space of 2 weeks because the LC1 was able to mobilize our witnesses. We had the case in that regard. So we understand that first, it is not just an effort for engineers, it is an effort for everyone. So the specialization and education of NWSC and the court and legal aid has reduced non-revenue water, as I said, and it is one that we have to go as a wholesome approach, and it cannot be done alone. So the summary and recommendation that through specialization and more funding to such initiatives, we are able to reduce non-revenue water and therefore supply water to other areas in the country. Thank you.
Thank you so much, Brownie. Members on the group, sorry about Brownie's network. It was not very stable, but we managed to listen to most of the presentation. Do we have questions for Brownie? In the meantime, Brownie, thank you for this sensitization, for you have sensitized the staff of National Water. You've sensitized more than 500 water users to collect the non-revenue money. And this is a great percentage from 40 reduction from 43 to 36 for over a period of 10 years. You're doing well. So let's get questions from members online, and let's see if we have any question for you in the chat. Okay, I think in the chat we don't have any question. The previous one is for Innocent. Members, do we have any question for Brownie before we call on the next presenter? Or can we use the chat room? So Brownie, in the meantime, as we call upon Evans to present, kindly keep online in case any other question comes on in the chat room. You should be in position to give to respond to the people online. So our next presenter is going to be Evans. Evans is also part of the people that presented during the Water Week. He had a very great presentation, and he's going to share with us about the SWIM and MARISCO models. So Evans, kindly share your screen, and you have 25 minutes for this. Then the questions will come in later, joined with Brownie's questions. Thank you. Over to you, Evans.
Are you able to see the screen?
Yes, we can see, but the presentation is not yet there. Okay. Evans, kindly put in presentation mode. Thank you. Kindly put in presentation mode.
Now, is it visible?
Yeah, it's visible, but is this in presentation mode, Evans? Click down for the presentation mode. We shouldn't be seeing your slides, the side slides, if you put in presentation mode. It should be down. It's something down on your keep in position to see.
Sure.
It should be down. So it's okay if you can't see it, if you can't put in the presentation mode, Evans.
Yes.
But we shouldn't, like our side, we shouldn't be seeing your side panels, the headers, the tools bar. It should be down. But if you can't see it, it's okay. In the interest of time, because I see time is not on our side, kindly go ahead and present. Try to be louder. Thank you.
Okay. Good afternoon, everyone. My name is Evans Odiero. I'm a master candidate in global change management at the Uganda University for Sustainable Development. And today I will discuss how we can integrate SWIM, which means Soil and Water Integrated Model, and MARISCO, which is an adaptive management of vulnerability and risk at conservation sites. And why? And this is to enhance flood risk modeling and to support adaptive water management in Uganda. My focus is in the Katonga catchment, and we will focus on the challenges, especially the increasing flooding that is being experienced for several years in Wamala subcatchment and other parts of Uganda, including recently in Kampala. We saw what happened, and I think some lives were lost, and we can repeat to the people that lost their lives. Through this presentation, I will highlight how SWIM model helps in hydrological modeling and flood prediction, and how MARISCO can support risk-informed decision-making for sustainable water management. So my outline will go into the destruction, the introduction, the problem statement, understanding what SWIM means for flood risk modeling, and the SWIM applications used in Uganda, introduction to MARISCO, application of MARISCO in Uganda, integrating SWIM and MARISCO for flood resilience. And then we will also look at the conclusion in terms of, So as we can see, one of the challenges that Uganda faces is increasing floods, and also not only floods, because we have extremes, so we also have times that we have drought. And this is due to climate change and also the land use changes that has been taking place all over the country. So Lake Wamala and its wetlands play a critical role in water storage, and they are under threat. So why SWIM? Because it can provide the hydrological modeling for flood risk assessment, and also MARISCO will ensure stakeholder-driven engagement. So the problem is the extreme floods and wetland degradation that is threatening the water security in Uganda, particularly in this area, but all over the country. And this is also due to limited data-driven decisions, making for flood management, and also the need for integrated modeling to adapt planning to enhance resilience. So combining SWIM and MARISCO can improve this scenario, and that will bring me to explaining understanding SWIM for flood risk modeling. SWIM model is based on two previously developed tools, and as you can see on the top right, this gives the history of modeling. And in the 1970s, the USDI, the Agricultural Research Service, came up with a model that was called CREAMS, and this was chemical runoff erosion from agricultural management systems. And based on CREAMS, several years from the 80s, a lot of models have been developed, and this can be seen, for example, GLIMS, which is actually groundwater loading effects on agricultural management systems. Example of EPIC is erosion production impact calculator, and going forward into ROTO, that is routing outputs to outlets. And also a lot of people are aware of SWAT, which is soil and water assessment tool. So SWIM actually couples two models that are based into mainly on Swat and Matsulu, and also brings in an integration of grass interface. How does this one help us? Because the soil and water integrated model is used for simulating river discharge, flood risk, and water availability. It helps us to understand how much water flows through a catchment. And in this particular case, we will start with the subcatchment of Wamala. How the land use and climate change affect water availability. And you see a lot of that area has been encroached because the Katonga catchment and also the Lake Wamala is one of the wetland sites, a Ramsar site. And also we need to look at how can we use this information for flood prediction and water security planning. Going further in understanding SWIM, SWIM inputs weather and climate data, that is precipitation. In tropical weather, it will be more on rain, and in Europe, it also inputs snow, temperature, solar radiation, humidity, and all that. On hydrology, also, it inputs the runoff, which is surface, subsurface, groundwater, evapotranspiration, natural and managed vegetation. And also, it also simulates the reservoirs, which will be of natural lakes and wetlands, flood protection, hydropower, water storage, and supply. SWIM application in Uganda would be has actually the potential to enhance flood early warning systems by analyzing past hydrological data, which are actually contextualized and parameterized with the local data, and also to project the future climate projections. And we can also identify, using this to identify high-risk flood zones, like the area of Lake Wamala. It can also guide infrastructure planning, where to build dams or flood barriers, and also support where resource management can be, focused on under climate change. And this will bring us to also the introduction to MARISCO, which basically means adaptive management of vulnerabilities and risk at conservation site. So MARISCO is conducted in 7 phases. It's when it was developed, it was conducted in 5 phases, but there's always been improvement. And it also starts, actually, it's more of a human-centered and ecosystem-based approach. It has actually what it extends, I would have to summarize, because it has like 30 steps in 7 phases. And basically what it entails is that, one, it does a spatial analysis of the area. It's like, what is the motivation and what is the expectation and the vision of the study, and also looking into the spatial analysis of the geographical scope. As we can see also that from the earlier photo of Lake Wamala, when it's flooded and also when it shrinks, you can see evidently from the spatial analysis. And then SWIM also incorporates the ecosystem diagnosis analysis of the area, and also more comprehensively assessment of the stresses. And this you can see at the step number 4, which actually has about 10, phase number 4, which has like 10 steps. So that will be the understanding the ecological stress analysis, the drivers of ecological stresses, underlying factors and causes. And this goes up to identification of systemic drivers, revision and validation. And this is always done with the stakeholders, and these stakeholders always comprise actually experts and the local focus groups that will be farmers, fishermen, and local authorities and academia, including the ministry, senior analysts, and also government officials. And it's also in part 4 also, to summarize, also it does what we call a scenario planning, and that will be into mapping the strategies, looking at the plausibility and effectiveness, and then it brings in the concept of vulnerability in adaptive conservation management, and that will have to come up in coming up with operational planning and implementation, and that is has like about 4 other steps that will come up with monitoring design, and we'll end knowledge management, So going further, this approach, why is it important? Because it helps us to understand the root causes of the water-related risk. And also it uses stakeholders' engagement for sustainable solutions, long-term climate resilience by integrating science and community. And the Marisco's model follows key steps. As I mentioned earlier, it assesses the current situation. So we identify the environmental threats and the climate risk. It analyzes the vulnerability, how to understand, how communities and ecosystems are impacted, looking up to the human well-being. It develops adaptive strategies that design practical interventions, and this is done together with the community and all the stakeholders involved, and implements and monitors which ensure effectiveness over time. The Marisco application in Uganda can integrate into the catchment management committees and scaled up into the catchment management plans. And this will identify key threats to water resources, develop participatory solutions for flood resilience, enhance collaboration between policymakers, scientists, and communities, and definitely the intersection would be bringing in SWIM to provide flood risk and hydrologic data, and at the same time, it's got to ensure adaptive decision making and stakeholder engagement. By integrating both, we can achieve SWIM's flood models to inform Marisco risk assessment. And these will develop adaptive strategies based on real flood data. And that will result into an improved disaster preparedness in flood-prone areas like the Wamala subcatchment. So Wamala subcatchment is my focus study area. This is a master thesis, and I'm thanking the area officials, including the Victoria Water Management Zone. Stephen, we have several meetings for the last 2 days, and I was in Mbarara. We just came back last evening, and we are looking at the possibility of using this SWIM and Marisco to look at the challenges that the Wamala subcatchment faces. This will be the look at into the peatland degradation, and we are talking with also the GIZ in regards to the just launched project Peat for People, so that we can embed our research into the work. And also we will look into the deforestation and land use change, which is increasing flood risk, and the limited community engagement, because most of the decisions are always been top down. So we have to involve all the communities in the area. So by using this model, these challenges, and also SWIM model and applying Marisco for adaptation, we can develop more effective flood management policies, nature-based solutions, including the peatland restoration, community-driven adaptation strategies, and this will definitely brings into my proposal, whereby now these workshops for subcatchment management committees are operationalized, and they embrace this integration. And this will conduct the first workshop in Wamala. We are looking at May. And this workshop will focus on training stakeholders on SWIM and Marisco, developing flood risk maps using SWIM models, and creating adaptive strategies for long-term resilience. The timeline will be May 2025. We will work with the Ministry of Water and Environment, and we'll engage the local communities and policymakers. And we also, and this including the stakeholders and NGOs like GIZ, the FAO. And then we will develop a roadmap for sustainable flood management in Wamala, and this will be scalable to other regions and subcatchments. The conclusion and call to action, to summarize, SWIM help us to predict floods and understand water risk. Marisco will help us to adapt and manage risk effectively. And together, they provide a powerful approach for flood resilience in Uganda. So my call for action is I invite all stakeholders to collaborate through this initiative and to let us work together to strengthen the flood risk management in Uganda, enhance community engagement in adaptation, and build community resilience for water security. Provided the references and also my contacts. This can be shared for further clarification, because this SWIM and Marisco they're new, and if anybody who needs more detailed information, I will be available to provide. Thank you very much for your patience, and I'm open to questions. Thank you.
Thank you so much, Evans, for this great presentation about the different models you're using in Wamala and Katonga subcatchment. So we are going to get questions from members online. Evans is an expert in SWIM, Marisco, so all the questions in line with his presentation, or in line with the models he's using, on whether he integrated or how he came to conclude to these models, all those questions are most welcome. And those of us who can't speak right now, we can still use the chat. Thank you. So members, any question for Evans? Can we assume we have all understood the integration of SWIM and Marisco for flood risk modeling and this adaptive water management in Uganda?
Thank you, Evans. May I speak, sorry?
Please, you're most welcome. Over to you.
Thank you, Evans, for that elaborate and good concept that you have. However, as we think about the socio-economic impacts, how are you going to consider the communities around, apart from helping them to stop the floods? If there's no floods, what next? Is it going to work only when there are floods? And if we don't have floods, there is nothing for these community members? Thank you.
Okay. As I said, the risks that are assessed does not only focus on floods. This is one of the areas of focus, and because of my study is involved with the water security, food and energy nexus. So we are not only looking at the floods, but I focused on the two models. And Marisco, what it does basically, it takes that into account, and that is the reason why the workshops, which is always a 3-day workshops, bring in all the stakeholders, including the focus groups who will be farmers and fishermen and the local communities in that area. And as data shows, actually, in that area of the Katonga catchment, this is from the catchment management plan, shows that in that area, one, there's a rapid population increase, which is estimated to be about 4.1 million by 2040 in that area. And poverty level actually is at around 76%, and most of people depend on subsistence farming. And this is leading to deforestation and wetland encroachment. So also, there is also weak governance in illegal sand mining, land grabbing, and poor enforcement on environmental laws. That is why we do this workshops so that these stakeholders can come up and join hands with the government, which is the policymakers, with the NGOs in the area that actually, I think FAO just did a project in the area recently, if I'm not wrong, I think in 2024, to look at this threat of poverty and now it is interlinked with the water risk, the food energy nexus. So our tool provides for a platform to to bring in these stakeholders into the planning of the policy and also into coming up with the strategies, the adaptive strategies built together with the local knowledge, the indigenous knowledge. So yes, it is incorporative of these people. Any other question?
Thank you, Evans. Kebirunji, I hope that answered your question.
Yes,
and worry about whether it will work on during flooding time. Can we have 1 or 2 more questions for Evans? And even if we still have questions for Dr. Innocent about the jungle units, the legal aid for Ebal, all questions, because these questions are going to help us understand more. Well, the presentations were very great, but still questions usually help the listeners to understand more. Okay, members, if we don't have any other question for all the 3 presenters, I think we are going to end this call here.
Maybe I had a question.
Okay, you're most welcome.
Yes, Stacey, thank you. I had a question for Evans. First, I wanted to thank him for the well-elaborated presentation, but I wanted to understand more about the SWIM model. How is its operation? Is it open source? I'm basically looking at the sustainability after we have rolled it out in Wamala. Shall it be easily usable by the stakeholders? That is my question. Thank you.
Okay, thank you very much. Yes, SWIM is a product of Potsdam Institute of Climate Change, and through the German corporation, it has been implemented in a few countries in Latin America and Asia, and possibly through the same collaboration, there is interest to roll it into use into Africa. Currently, as I speak, already the data that I have for simulation for the other partners that mapped all the entire Lake Victoria Basin and what we also refer to the Nile Basin, and also including part of the Uganda side, Kenya and also Tanzania. So yes, I'm working on an innovation which will definitely look into merging the SWIM and Marisco into a single model, and I'm working into the possibility of having it open sourced, which means it will definitely be, looking at partners. I'm talking to PIC, and also I'm talking to the developers of Marisco that also include GIZ was a sponsor for Marisco. And I'm also meeting them on Monday to look at possibility of bringing in an innovation which will be a model that incorporates the two, and working possibly of making it open source based on their support. But Yes, SWIM has been available, currently used by researchers, and on request, they've always supplied the data to organizations, the partner research institutions and governments, yes.
Thank you so much, Evans, for this elaborate discussion. Stephen, I hope the question of it being open and the sustainability part of it has been answered.
Yes,
And,
it has been answered. Thank you.
Okay, thank you. So do we have any other question? And like I said, the question now can be about the SWIM, and Marisco models can be about the Django units by Dr. Innocent, or still the legal aid, the legal clinics, the water clinics, the non-revenue water by Brown, Ebal for national water. So let's have more questions. Or I'll call upon some people. Fortunate, do you have any question for Evans? I know you're good with the modeling part. Kemigisha, do you have any question for Evans? So if we don't have any other question, I'll have to thank the three presenters for today. Thank you so much for this great presentation. And we will be calling upon you in case of anything, in case we need further explanation. And I'm glad most of us, the three of us that have presented today, some of us have other presentations. So anytime we call upon you to discuss, because we believe during Water Week, the time was not enough to have this discussed and well understood by the public and especially members who are on this call. So I think we are, yes, we are still in time. We still have more, like 5 or 10 minutes. I'll call upon Madame Gwendolyn, if she's on the call, to give us the closing remark.
There is Mulamuse and up.
Innocent, are you speaking to us?
Yes, Mulamuse's hand is up. Andrew's hand is up.
Oh, wow, okay. Mulamuzi Andrew, kindly unmute and speak to us. We are seeing your hand is up.
Yeah, yes, good afternoon, everyone. I hope you can hear me.
Yes, we can, Andrew. Go ahead. Thank you.
Yes, I'm Muramuzi Andrew from Chambogo, pursuing a bachelor's degree in environmental engineering and management, and also practicing in hydrology. My question goes to our last presenter. I personally have quite interacted with a number of models, both the distributed models and the lumped models. And the challenge I always face is that at times when you're applying these models with areas in Uganda, for instance, SWAT is US based. It's we always find challenges with aligning the databases of the different data sets with what is in Uganda. For instance, if it comes to maybe soil, of course, if you get challenges to align which particular soil layers will represent what is happening in Uganda. So I don't know how, if the last presenter could enlighten me on how the SWIM model fits in the applications within the region. Well, yeah, that's my question.
Okay, I will definitely invite you to take my email, I give an answer because I worked on the parameterization of the soil data and the daily discharge data for the Lake Victoria basin in Kenya for a PhD student. That is actually I'm assisting for his study, the assistant. And I personally had to look for the data from the ministry in Kenya, and the SWIM model actually captures the local soil data, and it also incorporates data sets like the hydro. I think if you are a modeler, soil grids, 2.5 to 50. Hydro also have the soil data that maps soil data all over the world, and they have, the databases for Kenya, Uganda, Tanzania, and also importantly, the hydrology also focuses the daily discharge data from different stations. As we were going to Barara yesterday, we passed through the bridge that was swept, and actually one of the stations there was washed away. So yes, that was my keen interest. Was I was asking about the available number of stations, because this data, this daily discharge data, are needed. So yes, SWIM actually is localized to take the local and parameterize with the local data. And I think I can also invite you to maybe, be part of this this study that I'm doing, as a collaborator based on your experience, and we can go through this together. So it becomes, a test that you can answer next year during the Water Week, that this is definitely a solution that SWIM has for parameterizing local data. So you can take my email and we can exchange further. Thank you.
Hello, good afternoon, ladies and gentlemen. And I just want Gwendolyn Chobulungi, coordinator, Water Resources Institute. I want to take this opportunity to thank the presenters, Innocent, Brownie, and Evans. We have good presentation, and want also to extend my thanks on behalf of the ministry for attending the Uganda Water and Environment Week and participating in the paper presentations. I want to thank for your good presentations, the innovative presentation. I think one of you got an award. Congratulations. I think this one, those members who have been listening in, we are interested in having innovation in water and environment sector. And this is one of them, and we hope to have so many people presenting to us through webinars. The Ministry of Water and Environment through the Water Resources Institute. We have got monthly webinars that are held on the last Friday of the month. Tuesday in February, we didn't have one because we are busy preparing for the Uganda Water and Environment Week. This one is the 26th, should have been 27th if we had done one in February. But we continue to attract and interest more researchers for practice and policy to come and present to the communities and to the stakeholders in the water and environment sector. And I want also to extend my thanks to Stacy Natkunda for moderating this session, and also even moderating during the paper presentations in the Uganda Water and Environment Week. I think those of you presented, you must have interacted with Stacy either physically or online. And we are appreciating Stacy's efforts and energy, and plus those who review our abstracts, the Makerere University headed by Professor Tugundu, and practice headed by Dr. Rosmita Birungi, those who reviewed our abstracts and advised us on improvement of our abstracts, and also at the end of presenting and selecting the best paper presenter, both ladies and female, rather male and male. On this note, I want to close this today's webinar, and we hope to meet you again next month. Have a blessed weekend. Bye-bye.
Bye-bye. Thank you.
Thank you all.
Stacy, Francis, and the minister at large, and everyone for attending.
Thank you all.